The placebo effect. There's a form of healing that doesn't begin in the body. It begins in belief, in expectation, in trust, in the quiet conviction that something will help, even when nothing physical has changed. This is the placebo effect. 1. When belief becomes relief. The placebo effect occurs when a person experiences real improvement after receiving a treatment that has no active medical ingredient. A sugar pill, a sham procedure, a neutral intervention, and yet pain decreases. Symptoms fade. The body responds, not because of chemistry, but because the mind anticipated healing. The brain does not ask first, "Is this real?" It asks, "Do I expect relief?" 2. The brain as an active participant. The human brain is not a passive observer of the body. It is an active regulator. When the mind believes improvement is coming, the nervous system shifts. Stress hormones decrease. Endorphins increase. Pain perception softens. The body begins to act as if healing has started. Belief becomes instruction. Expectation becomes signal. 3. Why hope has biological power. From an evolutionary perspective, hope was adaptive. Believing recovery was possible kept the organism engaged with life. It promoted rest, cooperation, and endurance. The placebo effect is not imagination. It is physiology responding to meaning. Meaning tells the body whether to brace or to release. 4. The role of authority and ritual. The placebo effect is strengthened by context. A white coat, a professional tone, a formal ritual. When treatment comes from authority, belief deepens. The mind assumes, this wouldn't be offered if it didn't work, and the body responds to that trust. This is why rituals matter, why environments matter, why how care is delivered can matter as much as what is delivered. 5. Placebo beyond medicine. The placebo effect is not limited to healthcare. It appears in performance, learning, confidence, recovery, relationships. When someone believes they are supported, they often perform better. When they believe they are capable, they often become more capable. Expectation quietly shapes outcome. 6. The ethical question. The placebo effect raises a difficult ethical tension. Is it acceptable to benefit from belief when the mechanism is psychological? Is relief less valid because it originated in expectation? Ethiax does not reduce healing to chemistry alone. Relief is relief. Suffering is suffering. But responsibility lies in honesty. The placebo effect reminds us, belief is powerful, and power requires care. 7. When placebo becomes manipulation. The line between healing and deception is thin. Belief can heal, but it can also be exploited. False promises, empty assurances, manufactured hope. When belief is used without integrity, trust erodes. The placebo effect works best when belief is supported by care, not manipulation. 8. Who benefits most? The placebo effect tends to be stronger in environments of trust, individuals who feel seen and supported, situations where meaning is clear. This is not gullibility. It is responsiveness. The body responds best when it feels safe. 9. Awareness without cynicism. Understanding the placebo effect does not weaken it. Awareness does not cancel belief. In many cases, belief remains effective even when the mechanism is known. Hope does not disappear when it is understood. It becomes grounded. 10. Responsibility in healing. The placebo effect reveals a quiet truth. The mind is not separate from the body. Expectation is not neutral. Meaning shapes experience. Healing is not only what is administered, it is also what is anticipated. This is Ethiax, where psychology meets responsibility. And responsibility begins when belief is treated not as illusion, but as influence.